Should you buy Ozempic or Wegovy or semaglutide off-brand? Should you get off-brand formulations? Many people are trying to get these medications to help them lose weight. There is a shortage, so many people are going online, going to compounded pharmacies, buying off-brand versions. Should you do that? By the way, sometimes prescription forms are very expensive for people or they can't get them, etc. So that's one of the reasons why people are going to these off-brands. Should you do that? I'm going to answer that question, but let me level set a little bit. I need to explain a couple of terms so you understand what we're talking about here. So currently there are 3 FDA-approved semaglutide products. Semaglutide is like the generic name for Ozempic injection. Okay, you've heard about that. That's actually approved for diabetes. It helps people lose weight. It's got other indications as well. Rybelsus, which is semaglutide tablets, also approved for diabetes. And you've got Wegovy injection, that's also semaglutide, that helps people with weight loss, adults and children age 12 and older. Okay, so those 3 brand names are semaglutide. All right, that's why semaglutide, we're seeing that along with Ozempic and Wegovy because that's the generic name. Now, semaglutide, what is it? What does it do? It's part of a class of medications called GLP-1 receptor agonists. It mimics a hormone that's released by your gastrointestinal tract in response to eating. One of the things it does is it helps make your body make more insulin, so your blood sugar lowers, but it also interacts with your brain to reduce your appetite and help you feel full. That's one of the ways that these medications help you lose weight. All right. Now, this is the thing. Ozempic, Rybelsus, Wegovy, they're only available by prescription. There are no approved generic versions, okay? They're all FDA approved. That means they've gone through rigorous testing, things like that, to make sure that they're safe and effective for intended use. Okay, we level set there. I need you to kind of understand that. But because there is a shortage of these medications, and we know this, right? It is hard to get Ozempic or Wegovy, right? Both of those medications, by the way, are listed on the FDA's drug shortages list. And because of that, pharmacy compounders may be able to make a compounded version of that drug if they meet certain requirements, okay? What is compounding? It's when a pharmacy actually sort of combines or mixes or changes ingredients to create a medication tailored to the needs of an individual patient. Usually it involves combining 2 or more drugs, but compounded drugs are not FDA approved, and the agency does not verify the safety or effectiveness of compounded drugs, okay? Are you following me? This is a story. But that's I'm telling you this because I want you to know this. This is the thing. So as I mentioned, compounded drugs are made by specialized pharmacies. This source that I'm talking about now is via GoodRx. They gave me this information. Specialized pharmacies make compounded drugs. They have a place in medicine, but they also have potential risks, okay? So when there's compounded semaglutide, that means they're custom made. That means that pharmacies will use a recipe that's likely different from Ozempic or Wegovy, and the compounded semaglutide may have different or extra ingredients. And the product doesn't go through the same rigorous testing and approval process that Ozempic and Wegovy go through. In other words, the FDA does not evaluate their safety and effectiveness, okay? But just like Ozempic and Wegovy, compounded semaglutide injections do require a prescription, okay? So that's according to GoodRx. I wanted to add that information. But this is the thing, guys, okay? And I know this has been maybe a long time coming in this video, but I do need, and I felt like I really needed to go through this to explain the process. What we are seeing is that there are compounding pharmacies that are making compounded versions of Ozempic, Wegovy, semaglutide, okay? But there are problems. And the FDA has released a warning about some of the problems they are seeing. Let's talk about that. Number 1, the FDA has received adverse event reports after patients have used compounded semaglutide. Now, I'm assuming this means that people have had negative side effects, but the FDA doesn't actually say which ones, okay? So adverse reactions or adverse events, meaning something hasn't gone right, that's been reported from people taking these compounded versions of semaglutide. Also, in the warning that the FDA has put out, the FDA says that that compounders actually might be using salt forms of semaglutide, including semaglutide sodium and semaglutide acetate. These salt forms are different active ingredients than what's used in the approved drugs, which contain the base form of semaglutide. And the FDA is not aware, and this is, I quote, is not aware of any basis for compounding using the salt forms that would meet the requirements, okay? This is a big deal. I hope you're getting what I'm trying to say is that the FDA is warning us that, hey, some of these compounded semaglutide products, number one, may be causing negative side effects in people. Number two, these pharmacies may be using forms of semaglutide that are not evidence-based, that are not recommended, etc., may not be safe, may not be effective. Okay, so what's the bottom line here? What should you know? 3 take-home points. This is according to the FDA warning. Number one, some products sold as semaglutide may not actually have the same active ingredient as the FDA-approved semaglutide products, and maybe the salt formulations. Okay, these salt formulations have not been shown to be safe and effective. Keep that in mind. That's the first thing you need to know. Number two, you should only obtain drugs containing semaglutide with a prescription from a licensed healthcare provider, and only obtain medications from state licensed pharmacies or outsourcing facilities registered with the FDA. Important, okay? And number three, purchasing medicine online from unregulated, unlicensed sources can expose you to potentially unsafe products that have not undergone appropriate evaluation or approval or do not meet quality standards, okay? And I need to give the FDA credit. Those statements I read verbatim because I wanted you to understand the language. They say that if you want to use an online pharmacy, go to the FDA's Be Safe RX campaign to look at their resources and tools to be able to make informed decisions. Guys, the bottom line is, if it sounds and looks too good to be true, it just might be. Do not buy stuff online, unsanctioned, unregulated, without your doctor's advice, without a prescription. You need to talk to your doctor. There can be potential harms if you don't. I hope this is helpful. I'll keep doing videos on this topic. Take a look at my other videos about Ozempic, Wegovy, semaglutide, etc. Please let me know if you're on these medications for diabetes or weight loss or both. They do work. I am a believer of these medications, but the brand name medications, the FDA approved medications, they do work and they are great meds, which is why we have to be very careful and educate ourselves and others about the dangers of buying the unsanctioned kinds, because there can be dangers in that. Okay, let me know your comments. Let me know what you do, what you take, what you use, and how these medications have worked for you, because again, in the approved form, they do work very well for people and have great benefits, can have great benefits for the right patient. Please share this video with other people who you think might benefit from it. On Facebook, please like and follow my page. Thank you so much for being here. Thank you in advance for those of you who send stars. Consider joining my subscription groups, Dr. Jen Superstars. Also on YouTube, please subscribe to my channel, click the little bell for updates, guys. Also go to drjencaudle.com to check out my website, my different offerings that I have. I have a daily newsletter, other subscription services. I'm Dr. Jen. I hope this is helpful. I know this was a lot. I'm Dr. Jen. I'll talk to you soon. Bye.